The opinions and statements made by the guests of the Success in Practice podcast are their own, and I do not endorse or accept responsibility for their positions. Any information given by myself or the guests is educational in intention and not to be taken as medical advice. If you choose to act on the content involved in the podcast, you do so at your own risk. Okay, everybody, welcome to the Success in Practice podcast. Today, I'm joined by Rosalba Courtney. Rosalba is an osteopath with a keen interest and, in my opinion, an expert in breathing therapy. She practices from two Sydney clinics at Avalon and Edgecliff. She's been a qualified osteopath since the 1970s when she gained a diploma in both osteopathy and naturopathy. She has traveled to the United States where she studied acupuncture and Chinese herbal medicine and was licensed to practice in California between 1980 and 1982. She has also completed a PhD at RMIT University. Rosalba was born in Croatia and immigrated to Australia at an early age, much like myself, where she grew up in Wollongong, just south of Sydney. My first exposure to Rosalba was at university over 20 years ago, where she introduced us to the concepts of breathing therapy and the impact of breathing on disease and health. She has been a pioneer in that field, in my opinion, and today continues to be a clinician, a teacher, a writer, a researcher, and a mentor to many students. Welcome to the podcast, Rosalba, and thank you for taking the time to chat with me this evening. I know it's late, and I really appreciate your time.
Well, thank you very much for that introduction, that very thorough covering of ground. Thanks.
I'm sure there's a lot more there, and we'll go into some of the more details as we go along. But I think today where we can really derive some value from chatting to you is to give people the exposure to what you're doing around breath work and how you've amassed such a breadth of experience in that domain. I really want to understand how you perceive the concepts of breathing therapy and how osteopathy has helped you shape your approach to integrative breathing therapy. And so I want to go a bit deep into the technical aspects of how you practice and maybe see if we can give some insight into how people can improve their application of breath work with their own patients, some tips and tricks there, and you're still practicing. So I'd like to go and explore some practical advice you would give to younger practitioners as well. Look, you've been very successful in pursuing your passion for breath work, and I'm sure it's a passion because you've put a lot of work and hard effort into it. And I'd like to explore your journey, and I think maybe give some insight to people who want to follow their own niche. There's people out there that whether it's treating younger children or treating certain injuries, and they really want to follow. And you've done that. You followed your passion, and I'm sure there's been some speed humps along the way and some challenges and opportunities, and just would love to learn how you tackled those. And maybe we could also look at the current landscape of osteopathy in Australia and get your views on that. And so is there anything that you want to add to that? Is there anything that you'd like to explore? And
Oh, let's just see where it goes.
Great. All right, so let's get started. Look, when did you first begin to realize the importance of breathing in disease and health? It seems so obvious right now, as I was discussing with you earlier. It's like when you spoke to us many years ago at university, we were just kind of amazed, but now it's obvious that we didn't really, it's like, yeah, this seems really obvious. When did it click to you that you can make such a great impact on a person's health by improving their breathing? Tell us about that journey and how it fits into the timeline of your career.
Okay. Look, I think that things happen. Sometimes it's just serendipity and coincidence and chance, things converge. But I remember having, the whole, because I had such a broad background, when I first started studying, I think I started with, naturopathy and osteopathy and Chinese medicine and acupuncture, herbal medicine, sort of all at the same time. And I spent about 10 years really exploring all those modalities. And the philosophies in those healing practices were very much about, find out what's causing the ongoing disruption in that person's, ability to heal themselves and stay healthy. And I don't think anyone talked to me about breathing all that much, but it seems sort of obvious that if someone was not breathing right, that would impact on, their muscular system and their symptoms and so on. And I had some dramatic cases. I remember one patient was a guy who was referred to me for treatment of his very, very stiff and tight rib cage. And he was breathing in this very weird way. He was breathing like and sort of grasping the air like that. And then he had a story. He said that he'd inhaled a bug up his nose
Oh,
and that it had gone into his lungs, and therefore he couldn't breathe properly. But the reality was he hadn't inhaled a bug up his nose, but he'd lost his job and his girlfriend had left him, and he had a
wow.
tremendous amount of stress,
Wow.
and his breathing had become disordered. And, this was giving him, the kind of behavioral issues around his breathing was impacting on the way his body was functioning. And I realized that I couldn't really fix his rib cage until I somehow tried to fix his breathing. And then I remember, I mean, many patients, but I remember another patient who had, this really strange breathing pattern. And she turned out she had like an acute gallbladder issue, that it was thought it was an acute gallbladder issue, but really it was only her diaphragm. And when we worked on that, then the issues settled down. And then I think it was like just a series of circumstances when I had my youngest child, who's now 32.
Mhm.
I took some time out of my practice and I had someone come in and look after my patients. And I was at home with my child, so I had a bit of time off. I had about 6 months where I wasn't practicing at all. And the a guy moved in on my street who used to live next door to my parents in Wollongong, and he was involved in bringing this, Dr. Biteko's protege to
Mm.
Australia. And I had the time to go and check all of that out. So I went and attended the clinic and got really involved and ended up becoming chairperson of the association. And I wrote training courses that I taught all over the world. And, but there was a series of things that kind of went on and on, but it was just a bunch of circumstances. And it just seemed like a no-brainer to me that, breathing was a fundamental thing. And the more I learned about it, the more interesting it became. And I saw amazing changes in people just from working on their breathing. So I saw people overcoming incredibly severe asthma and, you know, chronic and complex conditions, just from working really, diligently and persistently with their breathing. And so I sort of thought I had it figured out, back in the 90s. And the whole Buteyko theory was that, um, that people in modern society tended to hyperventilate or overbreathe,
Mhm.
and that the solution was to, fix the overbreathing. But and then I went to Russia and I met Buteyko, and and then I I started meeting lots of other people too, and started reading and looking at the literature, and I realized that there are a lot of conflicting ideas out there. And even though I was kind of like, one of the lead people in terms of training people in Buteyko, I just realized that, oh no, this isn't the answer. There's more to this. And so that's when I decided to, stop teaching, and I started a PhD. And that was in 1991. And the PhD was on the topic of dysfunctional breathing, its parameters, measurement, and clinical relevance. So what I wanted to understand was, how does breathing heal? Why are these people getting these extraordinary transformations? And if there is this sort of optimal way of breathing that helps to, keep you healthy, then there's this other thing, which is dysfunctional breathing. What is it and how do you in a structured kind of organized way, assess it and treat it. And that's basically what, out of that PhD, which it took me 8 years, by the way, or almost 9 years, out of that PhD came this model of kind of conceptualizing disordered breathing, and a treatment kind of assessment and treatment protocol that I call integrative breathing therapy. So, and that's what I do now.
And has that largely been influenced, obviously, by your approach and your thoughts as an osteopath? Like you mentioned that you were doing a lot of the Buteyko breathing methodology, and then you thought there must be something else. Is that part of your kind of detective work as an osteopath? Do you put that down to anything other than just seeing dysfunction that you couldn't help, or was it something inside of you that kind of led you to go down and look further into breathing disorders?
Look, I really think that sort of osteopathic thinking was there in the background, influencing the way I approach looking at things, which was this very holistic sort of approach, that you look at function and you look at structure and you look at the interactions between those two. But the process of the PhD was like, it's a little bit like, you're a little bit like a platypus, just sort of swimming through the murky water, and then you hit an obstruction, so you change direction and go somewhere else, and and then in the end you swim free into clear water, if that's a good analogy. But I just was incredibly curious,
Yeah.
I was incredibly curious, and I didn't stop being curious. I got more and more curious, and I just kept asking questions. And the questions, I turned those questions into research studies. And actually in my PhD, I published 7 different papers, and each one of the studies that I did got published, and
Yeah.
that they basically, I developed a set of tools, assessment tools, and the manual assessment of respiratory motion. I developed a questionnaire. I developed kind of, I did a study looking at the link between the diaphragm and how that influenced the body's ability to create, kind of coherent interaction between respiration and circulation, and so on. And I just sort of, in it was just this idea of, well, I've got this thing that's incredibly powerful, which is the breath, and there's all this contradiction out there. And as a practitioner, I just want to not be confused. I want to be able to go, this is what I'm doing, this is how I'm going to decide on treatment for a patient. And then I'm going to follow a protocol. I can reassess. If they're not better, I'll either change what I'm doing or refer them somewhere else.
Well, they're great lessons, I think, for practitioners. That the curiosity, I think, of a practitioner should always be there. And how you've kind of just described that as kind of a platypus swimming along, and being curious as to going in whichever direction, then you end up somewhere where you probably didn't think you were going to end up.
Yeah, absolutely.
Yeah, that's I think a lesson for a lot of young and experienced practitioners. I think we always need to remember that. Early on in your osteopathic career, who were your mentors? What did you feel that they gave you that was so valuable? Did you have mentors growing up into osteopathy?
No, not really. I tell you why. It was just that era. This is the
Right.
1970s, and there weren't elders really.
Right.
Do you know what I mean? Like, we were kind of, in a way, starting it. Like, it was a little bit like the Cultural Revolution or something, where the young people are kind of leading it. There weren't huge mentors. There were people who were teachers, but often the people who were teachers were just people who were 2 years ahead of you,
Right.
in college. And it's like our mentors were the books that we were all reading.
Okay.
There weren't kind of figures that we really looked up to, I suppose. I mean, I did study with all kinds of people. When I was actually in the days when I was teaching Buteyko, I was going to America a lot. So I was going to the United States maybe twice a year. And so I studied with a lot of people in the United States. I
And
did a lot. Yeah.
Osteopathically speaking, back here, whilst you were studying, did you bounce ideas off people? Who did you have some colleagues that you would bounce ideas? What were their thoughts on what you were doing and how you were thinking about breathing?
Well, I wasn't thinking about breathing then. Do
Right.
you know, I mean, I didn't really get into the breathing stuff till I was 40.
Okay.
And I
Right.
started studying osteopathy when I was 21.
Wow.
So it was already like a long time into my career.
And did you enjoy the aspect of osteopathy when you weren't doing breathing, when you were just seeing back pain and neck pain and these kinds of injuries? Did you enjoy that part of your career?
Oh yeah, I loved it. I always had a great passion for, whatever I was doing at the time, and always learning and studying with different people, and going off in different directions.
Mm.
I mean, in the days when, I mean, back in the 70s, the sort of stuff that we were doing was really fairly, you know, I look back now and I think it was all fairly basic,
Yeah.
but it was a lot of, we were very hands-on, so that I gained heaps and heaps of experience with manual techniques, and I really enjoyed that. I love that, and kind of thinking, you're thinking as you're practicing, and you're working things out, and you're developing your palpation skills and having new insights into how it is all hanging together. So that was all incredibly fascinating too. But also at that time I was doing quite a bit of you know, acupuncture and Chinese medicine. I taught nutrition for 15 years. I started a Chinese herbal company, you know,
Wow.
and first Chinese herbal company in Australia that was not run by Chinese. When I came back from living in Los Angeles, where I'd studied acupuncture and Chinese medicine, came back here and set up China Herb Company. And all of that was incredibly fascinating to me. And the breathing thing started when I was around 40. And then I did my PhD when I was 50.
Those early days, the formative days before the breathing work, though, they're really foundational. The basics, as you describe them, they're really important for every practitioner to kind of go through. It's kind of like,
Yeah.
that's the pathway, I guess. Um,
Yeah.
Tell us, fast forward now, today, what does your clinical week look like? What kind of volume of patients do you see, and is it mainly respiratory work that you do?
So I see patients um, 2 days a week at the moment. And then I do a couple of extra days at another clinic, at the clinic in Edgecliff.
Right.
I'm at my clinic here, my home clinic here in Avalon, 2 days a week on a Thursday and a Friday. And I see lots of, chronic and complex cases.
Mhm.
So here in Avalon, I still, see people who've been seeing me for years, will come for musculoskeletal work, for some musculoskeletal
Yep.
issue. But I tend to, kind of, I'm not that available. I'm only here, and often they can't get in for 3 or 4 weeks to see me. So that part of my practice has reduced. But I certainly do a lot of work with all kinds of chronic illnesses. And I don't do just breathing, I just look at, it's about the patient, what do they need? And they come with a problem. How do we solve that problem? But because I investigate and assess breathing so comprehensively, I pick up all sorts of stuff about them, by checking breathing in the airway and their sleep. So I'm interested in, sleep disordered breathing. I'm interested in sinusitis. I'm interested in paradoxical vocal fold motion, people with unexplained breathlessness, long COVID, chronic fatigue, POTS, chronic pain, pelvic issues, gastrointestinal problems, musculoskeletal issues that don't resolve, you know, well with normal manual therapy.
I'll go into those a little bit more later on. I just want to talk to you just briefly about this, especially this post-COVID time that we're in at the moment. Are you seeing a bit of long COVID, and is that something that you've been treating? And is there any advice that you can give to practitioners that may see it in clinic? Anything basic that they can look out for, or anything that they can use to treat?
Yeah. So, COVID is predominantly a respiratory illness that then affects the vascular system as well. And, there's often the persistent virus and the dysautonomia that kicks in, because when the body's trying to fight an infection, it will create, sympathetic arousal as part of that. It's part of how the immune system works. And so when they come to see me, they're often coming with respiratory, or if they come to see an osteopath, they'll often come with some unexplained breathlessness that persists after the condition has supposedly gone away. Or they come with extreme fatigue. And they'd be the main things that I would see them for. And so what I usually do is I sort of set about just assessing their breathing, which I do in my own way, and in terms of what someone who's not trained by me would do, you've got some good questionnaires out there that will identify, dysfunctional breathing. The one that I designed in my PhD is called the Self-Evaluation of Breathing Questionnaire. And I've published that, in the International Journal of Osteopathic Medicine. But using a questionnaire like that, you'll see whether there's a large number of respiratory symptoms. And very often those patients, because of COVID and the way they've been breathing since COVID, they often develop very, kind of abnormal breathing pattern, which really weakens the diaphragm. So there have been a number of studies done showing that the diaphragm is weak, thin, and at the same time tense and hypertonic. So that's certainly something that, as an osteopath, you could look at. And then the diaphragm's a real key driver of cardiovascular homeostasis as well.
Yeah.
So it's really important to get that diaphragm, working well to improve venous return. A lot of them end up with sort of POTS type symptoms, with orthostatic intolerance and POTS. And if you can get the diaphragm working well, that can really help the POTS symptoms, and also begins to regulate the autonomic nervous system, because breathing, of course, is one of the great regulators of the autonomic nervous system.
And when you're looking at the diaphragm, do you then often find yourself looking at, say, things like the pelvic floor and maybe the cervicothoracic fascia, just to look at those horizontal cross sections of the body and seeing how you can affect the pressure gradients across those? Hello everyone, I'd like to take a quick moment to thank everyone for watching and listening to the podcast. If you have received value from this episode, the kindest thing you can do for me is to like, share, follow and subscribe to the channel on whichever platform that you are listening on. If any of the conversations have resonated with you and you feel that I can help elevate your practice, you can find me at successinpractice.net. That is, the Success in Practice program can be found at successinpractice.net. The Success in Practice program is the signature program that takes a practitioner who may be struggling with retaining patients. They may not be certain about building effective treatment strategies, and they may feel somewhat anxious and doubtful about what they are going to do with a patient. And they are not really accelerating in the real world of private practice. It takes this practitioner and it turns their careers right around to the point where the patients have an effective diagnosis and a real treatment plan that they can take home. Patients are happy to book in multiple sessions with you, and they are confident about your abilities. And more importantly, you now have direction and are confident about your own abilities. The program streamlines how you operate as a practitioner. Guys, you should have been taught this at university, but you weren't. You may have been practicing for the last few years thinking there has to be a better way. There has to be a more effective way of engaging with patients and getting them results. Well, there is. And this is what the program delivers. Go to successinpractice.net and check out the options available to you. See where I can help you easily grow your patient list and finally earn the rewarding income that you deserve. For all the information on how you can reach me personally, check out the show notes. Also in the show notes, you'll find a link to the chat transcripts from these podcasts. These are valuable and a wealth of information. I really hope that you're enjoying the podcast. Guys, leave a comment if there's any questions on this episode. And please, don't forget to like, share, follow, and subscribe to the channel. Now, back to the show.
Yeah, well, definitely. I mean, people with diaphragm dysfunction, often will have pelvic floor dysfunction because the diaphragm and the pelvic floor move together. And if the diaphragm isn't, doing its exhale function properly, then often there's poor coordination with the pelvic floor. The pelvic floor doesn't relax. And, very often, okay, so if someone's not breathing effectively with their diaphragm, if the diaphragm's low, flat, hypertonic, or it's weak, then often what people will do is recruit other parts of their rib cage to breathe. And of course, then that ends up locking up the the thorax and the neck. And often you find that there's a forward head posture, so you get that, craniocervical restriction.
There's lots to treat there, isn't there?
Well, everything's connected, really. But the thing is, the reason that I'm so into breathing is you can manually treat those things forever, and not necessarily get to a satisfactory resolution. The whole point of doing breathing is that, like, they might come and see you once a week, and even if they came 52 weeks a year, they're breathing 20,000 breaths a day. So it kind of makes sense to work on retraining breathing, because the thing about dysfunctional breathing is that it's self-reinforcing. So when someone's breathing incorrectly, they will feel a shortness of breath because their breathing muscles are sending the wrong signals to their brain. So they will continue to make their breathing too effortful. And you can't relax those muscles because their brainstem is driving them to survive, because breathing is at the center of our survival mechanism. So, you could treat them and treat them really well, but their problems won't necessarily resolve if their breathing is so dysfunctional. And manual therapy can make a big difference. You can actually, some of the studies after COVID, did use a bit of manual therapy. I did a literature review. I actually submitted something. I worked with a couple of other osteopaths, with Imogen Collier in Queensland, in Canberra, and Zoe Steele in New Zealand, and we did a literature review on breathing retraining and osteopathic manual therapy, or not just osteopathic manual therapy, for the treatment of long COVID patient. We found like 15 or 17 papers on breathing, therapy, and we found 3 on manual therapy. So there wasn't like a lot out there, but there was a lot out there on breathing. So the whole paper, which we submitted 6 or 7 months ago to the International Journal of Osteopathic Medicine, and supposedly, I'm having a bit of a bitch here, but supposedly it's with reviewers. I've heard nothing back, and we put so much work into this paper, and it's just sort of sitting there and lost in some pile of paperwork,
Hopefully, when they hear this podcast, they click into action.
In the IHM office, I don't know what it is.
Rosalba, let me.
One of the things. Sorry, because I went on a bit of a tangent there. Right. One of the things that's interesting there is that one of the papers that I found was that they found that with diaphragm mobility, when people worked with, oh, sorry, I'm going to lose battery in a minute. That when people worked with, diaphragm mobility by doing, respiratory muscle training using inspiratory muscle resistance breather device, but they got much better mobility of the diaphragm when they combined it with manual therapy, when they did a diaphragm stretch, manual diaphragm stretch for 4 minutes.
Let me recap what you've been telling me, just so I can understand. So,
1 second, I'm just going to plug my battery in.
Yep, take your time. Plug it in.
Okay.
Okay, so let me just recap on what you've been telling me, just so I can understand and see if I've got this right. So people come to see you with not only respiratory problems, but even musculoskeletal problems or fatigue-related problems. Being the practitioner that you are, you go deep diving into their breath work, and you pick up on certain breathing disorders. And you're telling us that there's very effective ways that they can be treated manually with manual therapy. But what you're finding is that you can treat them 52 weeks out of the year, and they will still continually have those breathing disorders because it's a autonomic function. And what you found is that by doing some muscular retraining, and that's been the key to kind of try to overcome not just manual therapy, but you're looking at retraining
Breathing,
the
yeah,
breathing. That's
retraining
really
breathing.
that's
Yeah,
really been the key. Is that correct? Have I
yeah,
have I kind of summed that up
yeah, yep,
correctly?
that's right. Yeah.
Great,
Yeah,
great.
it's also important to retrain breathing. So, for example, if someone is people can have disordered breathing in the biochemical, biomechanical, or neurophysiological dimension. So, if it's biochemical, and they've been hyperventilating for a long time, their body's developed all kinds of compensations around that. They'll end up in a situation where they the biochemical homeostasis, of breathing is shifted. So then you have to kind of restore that. So you have to actually get them to learn to tolerate higher levels of CO2. They have to breathe in such a way that they learn to tolerate some CO2 retention. And there are techniques, lots of techniques using breath holds, relaxed, reduced breathing, slow breathing with hyperventilation control, and so on, to train them. And if they're breathing in a way where they're hyperinflating, continuously hyperinflating, then you have to actually really train them to not hyperinflate. And if they're breathing so that the breathing is poorly coordinated, where they can't go from the active to the relaxed configuration of breathing, then you have to train them to do that using posture and movement and different things like that. And then another thing that can happen with people is if their breathing is not right, they develop hypervigilance of their breathing, where they're so overly focused on their breath and they're always trying to breathe right. And they watch this video and that video and this thing on Instagram and YouTube, and they read this book, and they're trying really hard to always breathe right. They're watching their breathing, they're trying to breathe correctly, because they have this idea that, you've got to breathe in a certain way, into your belly or into the back of the ribs or into the side of the body or something like that. But the reality is that functional breathing is variable. It's adaptive. It's adaptive and it's responsive to postural change, to levels of metabolism and physiological arousal and so on. So trying to retrain people to restore normal flexibility and responsiveness of breathing, and to develop the correct type of attention to their breath. So they're not hypervigilant, and they're also not disconnected from the breath, which some people can be too, where they've got no ability to perceive their breath accurately. So they've lost interoception. They've sort of cut off. So they're the sort of things, So it's not just about teaching people to breathe into their belly and pushing up into the diaphragm, to dome it. It's way more nuanced and fascinating and really interesting and hugely rewarding.
That is fascinating. Before I go on to the next question, I want to just kind of ask a little segue question. Are you seeing any implications here in terms of performance with regards to?
Oh yeah.
Is that something you've seen? Have you dealt with that? Have you treated performance athletes? Is that something that?
Absolutely.
Yeah.
Yeah, absolutely. Yeah, I've worked with athletes in a few different ways. I mean, athletes will often top of their field, and then all of a sudden it's like unexpectedly they just appear to not be able to, perform very well at all. And then they become a bit of a mystery, or just a tragic case. And then often what's happened is that their breathing has become disordered, from hard training, pushing hard. They've just developed dysfunctional breathing. They've started hyperventilating chronically, they've lost their bicarbonate buffer reserve, their anaerobic threshold drops, and all of a sudden their heart rate appears to go up. They can't hold their breath. They get easily breathless. So I've worked with lots like that. And then
there's implications for recovery there too, isn't there?
oh yeah.
Yeah.
And with overtraining syndrome, it's really the
metabolic syndrome.
yeah, where people lose their when it's kind of a bit complicated, but
Okay.
when someone's been hyperventilating, then the first thing they do is they develop a respiratory alkalosis, and then they'll compensate for that by excreting bicarbonate in their urine. So then they develop a type of metabolic acidosis. But then the compensations that their body makes are not perfect. And if over a long period of time there's been a lot of loss of bicarbonate, then there's another correction stage where they actually start to lose levels of it's not glutamate, it's something else, but they actually lose, really a lot of kind of metabolic reserve. So you've got to kind of pull back on all of that.
That's a whole nother I think sphere to go into. I remember working with a very experienced dietitian in my clinic that picked up on a lot of these metabolic conditions, and she mentioned the exact same thing that you did. And she was a dietitian, a very experienced one.
Yeah, right.
And it's amazing how you two were seeing the same thing. In terms of actual treatment, in terms of your daily treatment, tell us about your toolbox, Rosalba. Like, what are some of the techniques, be they direct or indirect, that shape the treatment from you? Like, how what would it look like?
From an osteopathic perspective?
Yes.
So I would do, I've actually developed a protocol that I call the breathing muscle reset. And it's a protocol that I'll often use alongside, breathing pattern retraining. And the breathing muscle reset is a protocol of maybe, I don't know, 15 moves or something. And it's a treatment that you can do in half an hour. And it basically works its way through, the person's lying supine.
That's an active treatment or a passive treatment?
An active treatment.
An active treatment, yeah.
The passive treatment that I've usually done with them is I would have started off, with other stuff, like I might have started with a protocol that I call the breathing basics, which is a sort of a breathing movement. It's about training sensory and motor aspects of breathing, working with different positions. So they do that at home. And then in clinic, I do a manual therapy protocol, this breathing muscle reset, which uses a lot of, it's like post-isometric relaxation with stretch. And I work on, all the parts of the breathing system. So I get the lumbar spine moving, I get the lower ribs moving. I work with them laying face down, and then I get them on the side. And then we use sort of, muscle energy type stuff on the lower and the upper ribs. And then I work into the, the neck and the scalenes and the suboccipital triangle. And then laying on their back, I would then work on the rib cage and then, the diaphragm. So really kind of, stuff any osteopath could do, but I've just got this really smooth little protocol that I've developed. And I did some research on it actually with patients with chronic back and neck pain. We did the breathing basics and the breathing muscle reset, and also did it with asthma patients.
Well,
that's one of those papers, but the results were very good.
Well, that's a good way. That's a good way to segue onto the next question. Tell us about some of your research. Some of the work that you've done, and in the implications of that research. What's that been like for you clinically? Has there been? What are the main milestones? I mean, you've done a lot of research. What have been the main ones that people can look out for that have really shaped what you do clinically? You've mentioned some of the protocols. And you mentioned some of the system. I think there was a systematic review that you discussed earlier that you've done with another two osteopaths.
Oh, well, you know what? I've published a lot of papers now, but say in the early days, the papers that I was publishing were about assessment techniques. So there are assessment tools. And then, I've tested a few protocols and then looked at a few disease conditions. So some of the recent stuff that I did with some students at Southern Cross University was on a nasal breathing rehabilitation protocol.
Mm-hmm.
And that paper seems to have had a really big impact. It's been downloaded like thousands and thousands of times. And it's a great, the whole process of doing research was not to prove that something worked. It was really to refine a protocol and get it working really well. And so that whole process of, it took 2 years to kind of think it through and look at the research and figure out, well, this technique will probably work and maybe that technique will work. And how about this? And then we did a feasibility study where we delivered the protocol, over 4 weeks to 25 people. And it was the beginning of COVID, so it was all done online. And they all improved, which was fantastic. So now the implications for my clinical practice is just when someone comes and they're, have issues with sinusitis or their mouth breathing, say they're an athlete or they're just someone else, who has a history of nasal obstruction, so their mouth breathing, or there's someone with snoring and sleep apnea, then I just feel really confident knowing that I've got a protocol, that I've really kind of refined and done well. And then recently we did I worked with a colleague in Boston, and she works at Massachusetts General Hospital, and she works with a lot of top people there, and they just referred her heaps and heaps of patients. She was one of the students who did my integrative breathing therapy practitioner training course, and she had to do case series to get her certification with me. So she chose long COVID because she was getting referred so many patients with long COVID. So she did the whole integrative breathing therapy 6-week protocol with them, and did publish that as a case. We published that together as a case series. But the thing about research is that, and the thing I'm always telling osteopathic students who I'm mentoring is, don't think about research as a way of proving that osteopathy works or that what you're doing is already working. It's like what research is all about is testing ideas and refining, protocols and improving things. And then it's way more interesting because you go into it with an open mind and curious, not knowing where you're going to end up, what you're going to, of course, you get the process of research is also the preparation of the study, that you do through looking at literature and thinking about it deeply and so on. But that would be what I've gotten out of it recently. And then another paper that we've done recently has been on, I'm working with someone at the moment, actually, in Norway. I was just working on that paper today, but she's doing a study. She's a GP who did my training in Norway, and she is looking at the integrative breathing therapy protocol for patients with MUPS, which is medically unexplained physical symptoms. And she did a kind of a pilot study that she's now looking to publish. But it's like in that process of doing that, she learned so much about what that is. And I learned so much from, mentoring her and helping her.
Yeah, I think the journey of the research is probably where the education happens.
Yeah,
Not
sure.
so much what you think the result's going to be.
Yeah.
You've listed numerous courses and professional development you've undertaken over the years, and they were too numerous to list. That's obviously been very important for your development. What are you doing at the moment? Like, how do you? I mean, other than research, I understand that. How do you choose a course or a path of study? What's your? Do you have a criteria? Do you know what makes Rosalba kind of go? Yes, I want to. I think I need to learn more about this.
Learn more about that. Um,
Or maybe what was the last thing that you did and why did you do it? Just to give us an idea of your thought process.
yeah. Um, oh, I don't know that there's a clear answer to that. Of the stuff that I've studied recently,
Is it something?
um,
Is it something that you're coming up against at the clinic, and you think, well, there's a bit of a, I need to know more about this, and then you go on, you
Yeah,
find out more
yeah.
about it.
One of the things that I'm really sometimes it's not in courses. I'll just dive in deep,
Yeah.
into something. So at the
Well,
moment,
that's what I mean. It doesn't have to
yeah,
be a course, but just a path of study,
yeah,
you
just
know?
the path of study. So,
Yeah.
so one of the things that I'm exploring at the moment is just looking at the interaction of mitochondrial function with stress.
Okay.
So how stress is just a very energy hungry process, and it impacts on mitochondrial function and can actually lead to disordered mitochondria. And once people develop, mitochondrial dysfunction or disorders, then it actually influences their ability to tolerate stress. So, because one of the things that I'm intrigued about is how a lot of the people who I see, like they've just been bashed about by life. I'm sure with your patients too, and people have a bunch of things happen to them, and then their health falls apart, and they can develop conditions that are not that responsive to treatment, because at the core of it is the need to have their body restore homeostasis and be able to regulate um, the stress response.
Well, cortisol is often talked about when it comes to stress response, but and they call it the stress hormone. But I think what it actually is an energy mobilization hormone. Cortisol is really used to mobilize energy, and that goes back to your point of the implications on energy in terms of mitochondria.
Yeah, that's right. So much is about energy and the body budget.
Mm.
So much of what people experience as symptoms and even mood disorders really has to do with how the body budget, the energy budget
That's so important when it comes
is
to
working.
recovery. With recovery, it's so important, and we,
Yeah,
as osteopaths, we kind of learn that our abilities are only as good as what the body can recover. You apply your treatment.
yeah,
If the body's not doesn't have the capability of recovering from the stress that you've applied, it's just not going to adapt, and you may not go too far with treatment. But that's a very important thing for people to I
yeah,
think understand. Look, you've seen a lot of practitioners, and you've worked with many people. Can you describe to us some of the key components to what you see as I'm using the word success as a practitioner, but when you
yeah.
see people who are doing well at what they do, what are some of the key features that you've recognized across the years? What do they have, some common things that you can? I mean, I know
Yeah,
that we can see it in business, and when you talk to business people, they'll tell you there are some key traits of people that often succeed. What have you found in terms of the
yeah.
clinician? In terms of the clinician, what have you found to be the common traits of a successful person? Somebody that's doing what they want to do, and is doing it well.
Yeah. Look, I think that they would have developed, just sort of excellence in a particular area. I think that having a niche is really good.
Yeah.
Um, I think if you're a generalist, you can do that quite well, and you will be like every other generalist. And you'll do well, particularly if can run an organized clinic
Mm.
and you've got good people skills, and, you're just professional and keep a clean clinic and,
Yeah.
keep up to date as a generalist. But I think that the people who, stand out are often the ones who have developed an expertise in an area, and they become known for that. And I think that that leads to a sort of a greater success.
Yeah. Amazing. That's exactly what I think too. And you've lectured, and you've been involved in academic endeavors. You've mentored many young practitioners. What are some of the challenges that they talk to you about? The people that you're maybe doing the course with. The teaching your
Yeah.
integrative breathing course. What are some of their challenges? Do they talk about some of the anxieties they have in clinic? Any problems that they're seeing? Where do you feel like that? Where do you think that you need to help them the most? Hello, everyone. Just a quick break to give you some information on where to best find me. The first place is the private Facebook group called the Successful Practitioner Pathway. I've set up this private group as a place where practitioners can go and get tips and advice on how to best accelerate their practice and improve their clinical practice skills. The second place to find me is at successinpractice.net. That is where the Success in Practice signature program is housed. You can find more information about me and how I can best help you achieve success in your practice. So, the two best places, the private Facebook group, the Successful Practitioner Pathway, and successinpractice.net. I will link to both those places in the show notes. So, for more information, please see the show notes. Now, enjoy and back to the show.
I don't really focus on that very much. I'm mostly just trying to teach them about my stuff, and getting feedback from them about that. And I think one of the things I've noticed is that people sometimes get caught up in sort of like little billabongs, if you like. They can put a lot of effort and energy into something that they get caught up with that's not very sound.
Right.
Do you know?
So do you mean like they're majoring in the minors, that kind of thing? They're kind of.
I think they get distracted and they get bamboozled and fooled by something that's glittery. Someone's
Right.
sort of says, "Oh, this is the answer to everything."
Yes.
And then they'll go off on that and they'll do this and they get all excited. I mean, I've done it myself. I just remember doing that as a young practitioner. You go, "Oh, this is really great. This person's really charismatic and they're teaching me this fantastic stuff."
Yeah.
But I think that you've got to really always come back to, you've got to be grounded in science and reason. And I think evidence-based medicine is really important. And, the art of healing is important, but it's important that that's grounded in, in science, really.
One of the things that I'm teaching some of the students in the course is, it's the module itself is called "Don't Believe the Hype,"
Right.
and
Yeah,
it's just about not going on that emotional roller coaster of
right.
taking too much out of the positive and then too much out of the negative. And I think if you
Yeah.
have a certain framework within your own mind, which obviously it takes time to develop, and you use that as your litmus test, that makes sure that you just don't go on this emotional roller coaster of
Because there's so much of that out there.
Yeah.
Isn't it? Because as a young practitioner, you're out there and you get excited about something and you want to have the edge and, but then you get caught up in something that's not that sound.
A good segue is to now ask you, how do you see the future of osteopathy in Australia? You've been around since the 70s. I mean, you're a perfect person to talk to about this. What are some of the challenges and opportunities ahead of us as a profession? And what advice would you give, to the future leaders of this profession? You've been there, you've seen it from the start. If you could, offer us some advice of, in 50 years' time, what would you like to see? Where would you like to see the profession? If you could have your way, Rosalba, if you could have a magic wand and just, wave us into there, what would you advise?
Yeah. I mean, I was at a coffee shop the other day and there was a woman and she heard me talking to my friends and she said, "Oh, I said something about, an injury or a pain or something." And she said, "Oh, I just wanted to ask you because I've got, a sore neck or a sore shoulder or something." She said, "Can you tell me a good physiotherapist to go and see, here in Avalon?" And I said, "Oh, I don't know. There are probably plenty of good physiotherapists. I think you can just have a look in the phone book, get on Google and find
The
someone."
phone book. The
I
phone
don't
book.
know. That phone book, yeah, right. The Google phone book. And I said, "Oh, but I do know, look, there's an osteopath just across the road there. See that building there? There's an osteopath there." And I pointed. She said, "Oh, no, but I wouldn't go to an osteopath because, they're not properly trained."
Right.
And I said, "Oh, actually, that's not true. They do have university training, and I think they actually have more years at university than physiotherapists. And they're very, highly skilled with the hands-on manual therapy. Their skills there are particularly good." And she said, "Oh, no, I know I wouldn't." So I think there's still an issue there with overcoming public perceptions of
Mhm.
osteopaths being maybe not quite, trustworthy. You still got big issues there with referrals from medical practitioners. And I don't think it's just in perception. I think that there's a kind of a confidence issue in osteopaths themselves, where they still feel, undervalued in themselves.
Mm.
And so they often come from a slightly defensive position, in terms of, then they get very protective of the identity.
Mhm.
And I think that you can get overly caught up in your identity as an osteopath, but I think if you just think, well, I'm an allied health practitioner and I'm here to help my patients, and I'm
Mhm.
going to do it by being really rigorous in how I, approach their issues and their problems, and you just stay on top of educating yourself. And in terms of advising the profession in the future, I sort of don't operate in that level, on that level. I don't. I've become sort of reasonably isolated, I suppose. I'm not involved with any of the universities at the moment, and I don't really, go to meetings, and, so I'm kind of a little out of touch with what's happening in the profession. But
Do you feel supported, Rosalba, in what you're doing? I mean, you're doing a lot of research, and you're kind of still blazing a trail. I mean, I don't know of anyone else that's as far ahead in this field as what you are. Do you feel like you're supported? I mean, is this something that can we do a better job of not just yourself, but there are other people who are
oh, you
doing
like
similar
like
things?
me in positions like me. Yeah,
Yeah, like is there
yeah,
any?
right. No,
Yeah.
I feel completely unsupported.
No.
It's really interesting because like physiotherapists are very interested in breathing.
Mm.
And so I have physiotherapists who will, quote my papers, and they will, um, you know, kind of approach me for this or that, or whatever. But I'm an outsider in their profession, but I don't particularly feel supported within osteopathy for doing what I do at
Right.
all, at all. And there have been, times when I've applied for research grants, or, looked for help here. I did so much work working with students for free for years and years, never really got very much support or any support for any of that. So but that's not nobody's fault but my own, because I've just been a bit of a maverick and outside the flow of things, or just a bit ahead of the game, actually, often.
Well, yeah, I was going to say that. I mean,
Yeah.
that's. I think that's the way that progress happens too. It takes someone to kind of come out of the shell and be a maverick. For like I said to you at the beginning of the chat that we're having, in those days when you were lecturing us, we all thought that, oh man, this kind, your kind of thinking was something that was, it was new to us, and it was outside of, maybe what we needed as, new graduates. We just needed to help people with their posture and their backs and their necks and
Yeah,
but then,
absolutely.
and now once you become a practitioner and you become experienced and you think about some of the things that you talk about, Rosalba, it's you just whack yourself on the head, you face palm yourself, and you go, how do we not see this? So if there is a way, and if people are listening out there, there is a way that we can support Rosalba, I think everyone should get behind it. And I think I will ask you in a minute about some of the resources that you have, and if there's ways that we can support you that way. But look, just to finish off, I wanted to thank you for your time today. I feel really grateful and blessed that I got a chance to have a chat to you. And I'm going to continue this conversation for my success in practice students with Rosalba. But at this point, and that conversation will be more specific about the aspects of breathing, health, disease, and some of the common presentations that Rosalba will see in the clinic. For everyone else, thank you for joining us today, and it's been a pleasure, Rosalba. Thank you so much.